We're talking about the importance of building and protecting muscle when you live with an autoimmune condition like Hashimoto's disease. And we're here with Dr. Emily Kiberd, who is a chiropractor. She's a movement specialist and a strength enthusiast, and she lives with Hashimoto's herself and has committed her life and her career to helping women who struggle with Hashimoto's beat fatigue, lose weight, and feel more confident in their body. So, Emily, I will pass it over to you to introduce yourself. Maybe you can tell us a bit about who you are, what you do, and what led you to be interested in helping other thyroid patients get stronger and feel more confident.
So I'm Dr. Emily Kiberd. I've been a chiropractor since 2007 in New York City. And I'm kind of like the chiropractor who only adjusts when it's necessary, which most chiropractors or people who love chiropractors would probably just gasp like at that. But I really love movement and rehab and strength and figuring out kind of a root cause of why someone is in discomfort. Maybe it's like an old injury or something internal going on, because organs can refer to places in the body. And in 2015, I had my first baby. His name's Elvis. He's 5.5 now. And, you know, as a new mom, you have no idea. Everything is just like so new. And you can hear girlfriend stories and you're like, okay. But I was really struggling with a lot of exhaustion. Like Monday, end of day, felt like I had worked like a 60-hour week. I was just like on the couch, zombie. And I had difficulty losing the baby weight, which, you know, people are like, oh yeah, you just had a baby, that's normal. And I really had some bad brain fog, like could barely finish a sentence. When you're working with patients, you kind of have to be on and like just really clear and present. And I'd be starting a sentence, I'd be like, eh. So I was really kind of like a shadow of my normal self. And, you know, 18 months postpartum, these symptoms were still going on. And you know, people are like, yeah, you're not sleeping, new mom. I'm like, no, dude, my kid's a 1.5 years old. So like, this is not like postpartum symptoms. And so I started to kind of go down the road of like, what is going on? Kind of always that spirit that I have in my practice of like staying curious, and saw primary care, endocrinologist, actually a couple of functional medicine doctors, and was put on different protocols. And then one of my friends who's a physical therapist goes, why don't you see my friend, Dr. Gabrielle Lyon, who's a functional medicine doc. She had an office right near mine in Midtown, New York. And she did a bunch of blood work, and she was like, how come no one else tested more than just like TSH, thyroid stimulating hormone? I was like, I don't know, that is not my jurisdiction. Like that is your field. And she's like, well, you are on your way to an autoimmune condition. You have the presence of thyroid antibodies, and you have elevated TSH, and like, let's start changing diet and lifestyle and start to kind of dig for those root causes like mold and parasites and heavy metals and all the things that many protocols later I've done. And because our offices were so close, she's like, listen, I'm doing all the like functional medicine stuff, but I need you to get these autoimmune women strong. Like they're kind of doing some walking, but we really need to focus on their muscle. And we basically co-treated people. And so through my own journey of really cleaning up and figuring out my own Hashimoto's, you know, it probably took like a good 9 months to feel like I had energy, or to even just feel mildly better. But from that point on, it was really starting to change, you know, how am I working out? I used to do like I used to go to a Soul Cycle class, and then I used to go to a Barry's Boot Camp class across the street for like 90 minutes of like hardcore working out. And I was like, maybe this is not the way, because I feel drained afterwards. So really just shifted my own workout to more strength training and kettlebell based, because it's really easy to do from home, and kettlebells are very forgiving when you're learning form. And yeah, and then Gabrielle and I started to co-treat patients and just see them get better much faster than if I was just trying to figure out the biomechanical and she was just trying to figure out the, you know, the autoimmune components. And so out of that, you know, I started getting women from like Florida and Utah being like, hey, like I'd love to come seeing you in New York, but I'm not in New York. And so I was like, let's bring this to a greater population. And kind of out of that came Thyroid Strong, which is a exercise program on how to work out without burning out. Because I think it's a very fine line of challenging your body enough to stimulate muscle without like pushing yourself into a flare up or feeling like you can't get out of bed for 3 days.
That's awesome. And I like that it's like your personal experience and your professional experience have all been sort of married into what you're doing now and how you're helping people. Yeah. I know you talk a lot in your program and in your work about switching from like hours and hours of cardio to shorter strength training sessions. Can you explain a bit about why this supports thyroid health and associated symptoms?
Yeah, so I think doing lots and lots of cardio, with any exercise, right? It is a stressor. And so with lots of cardio, you're really only getting the benefit during the cardio session compared to if you are resistance training and focusing on the muscle tissue, you're getting benefits much greater than just the time working out. A lot of weight loss from cardio is actually like water weight loss. And I think especially for all the women struggling with thyroid issues, a lot of people focus on like, listen to your body, which I am right there with them, but I also think it's important to focus on the muscle tissue, especially with an underactive thyroid. We can have like low muscle tone and low muscle mass. And if you think of muscle as like our metabolic engine, it burns calories even when we're not lifting. It's neuroprotective. It's a place to dump excess glucose. So if you just kind of like binged on a bunch of carbs, you could actually go strength train and use that excess glucose up. And it directly affects our longevity. And some people even call it the largest endocrine organ in the body. So every cell has a thyroid receptor, right? Every metabolic process needs thyroid hormone, including the muscle tissue. And if you stimulate the muscle, you can actually, there's about one study done on men, unfortunately, but they had them walk and then take their blood work after, and they saw changes in their thyroid hormones. I would love a study to be done on women in strength training. That'd be more interesting. But thinking as like the muscle as this organ in the body that can affect your turnover of thyroid hormones. So, you know, if we want to live like a really long, fulfilling life, I would encourage women to focus on the muscle tissue. And I even did an experiment on myself. So I strength train probably like 3, maybe 4 times a week, 20, 30 minutes. And I was like, you know what, I'm just gonna do a little experiment. You know, we always focus on like the 10,000 steps a day. I'm like, I am only gonna do 10,000 steps a day, no strength training for like 3 weeks. Because some of the research shows that after 3 weeks, you can start to decondition. And like a week in, I was like, why do I feel like I felt so like low energy, like low vibration? And I felt kind of depressed. I was like, what am I doing? What's my purpose? I was like, why do I feel this way? And you know, I did the 3 weeks, and then I did like 20 minutes of strength after, and I immediately felt like that, like endorphin release. I was like, oh, that's like the Emily I know. So I know a lot of women, especially if they are very acute and flared up, focus on low impact, right? Because that's what we're encouraged sometimes is take a walk, Pilates, yoga, I would encourage women, even if it was like very low reps, long rest breaks, which I really encourage, to pull some weight, to pick up something heavy with amazing form, put it down and do it again. And it doesn't have to be 3 sets of 10. I know like it's kind of like the trainer focus, because that's where like muscle hypertrophy happens. But what if it was 3 reps or 5 reps, just to stimulate that muscle tissue? So yeah, I feel like a lot of women push themselves into like an adrenal insufficiency, and actually break down their muscle tissue by doing too much cardio, because they're chasing the weight loss, right? But get my friend Gabrielle, she talks about like, what if we instead of focused on like too much fat, if we focused on like under muscled, and then started to really focus on the muscle.
Yeah, I think that's interesting about your experiment doing 3 weeks of just doing steps. I imagine that was challenging for you.
Oh my God. I was like, just like I would like all the kind of like symptom, like I felt like I was losing muscle tone, which I was. And I felt low energy. I was like, oh my gosh.
I think something you probably hear from your clients, and like I think of this even myself, but when I hear strength training, I think like CrossFit or like Olympic weightlifting, like sort of this more extreme, end of it. And so for a population that is doing a lot of yoga and Pilates and low impact exercise, that jump might seem really intimidating. I know you're going to show us some sort of like demonstrations of moves later, but maybe you can talk a bit about what a strength training workout might look like, in 20 minutes at home.
Totally. And I think that sentiment comes from like, when did we learn to strength train properly? Like maybe in the weight room in high school, maybe a little intimidating, maybe in college, like probably hired a trainer. I've like done courses for trainers, and I would probably say like not the majority, but like there's definitely a percentage that are going for like reps and sets versus like form, breath, where are you feeling the move, what's getting engaged. And I like to focus on really functional movements, so movements that have carryover to life, because we don't really work out to get better at working out. We work out to be better at the rest of our lives, right? So like, for example, this weekend I'm moving houses. My mom is telling my 72-year-old mother, who also has a thyroid condition, is telling me to wait for my husband to come home to move boxes. Well, my husband's in Spain for the next week. So like moving boxes doesn't feel like this, feels like what I've trained for, right? So I've been training for life. And those movements would be some sort of hinge, like a deadlift, some sort of push move. That could be a press, it could be top of a plank, it could be a plank off a kitchen counter, right? It doesn't have to be, pounding out push-ups at the gym. A squat, some sort of pull motion, a lunge, which I know is squats and lunges are very tricky for women with Hashimoto's, and we can talk about why. Some sort of carry, like you're carrying groceries, and then some sort of anti-rotation. So those moves, and there's no bicep curls, tricep dips, crunches, because I want the workout, as I believe workout should be, to make us better at life, right? So some mix of those movements, maybe it's 3 to 5 reps. The research shows that to maintain your muscle, you have to hit a point of perceived exertion, right? So let's say on a scale of 0 to 10, 10 is, I can't pick it up at all. Like there's no way it's getting picked up. You want to be at like a 7 or 8 by the last couple reps. So you could either do less reps, heavier weight, or you could do a lighter weight with lots and lots of reps. And I like to really focus on the first option, because I find with lots and lots of reps, there's a higher tendency for an overuse injury. So yeah.
Which is a good segue. You just mentioned that lunges and squats can be difficult, that there's things to consider around injury and exercising safely with Hashimoto's or an autoimmune condition. Can you
Yeah.
talk a little bit about some of those considerations for thyroid or autoimmune patients?
Yeah, totally. So it might sound like, and I've had women say this to me, is like, I am afraid to get on the floor and play with my kids or my grandkids because I'm afraid I won't be able to get back up because my knees hurt so much. And when we have an underactive thyroid, there is slower tendon turnover. And what does that mean? It means, all of our tissue is going through cycles of replenishing and regenerating, and it's slower. Like the tissue, especially the tendons, recover and turn over slower. So especially the tendons that will cross a joint. So the infrapatellar tendon from like the kneecap to the tibia, the leg bone, a lot of the tendons that cross the shoulder joints, so all the rotator cuff muscles, the bicep tendon. That's why you hear women with thyroid conditions, they're like, you don't hear a lot of neck and back pain. You hear like my shoulders, the hips, the knees. So where the tendons will cross the joint. So to be better at those things, like getting on the floor and playing with your kids, you have to train that, right? And there's definitely different cues to be able to do that. And it doesn't have to be like grab 2 weights in your hands and do walking lunges. I would say that's an actually very advanced version, right? Or even like squatting, same thing, like squatting to a chair unweighted, or holding on to something to counterbalance your weight. Like ideally it would be like a TRX, but most people don't have those hanging around in their house. So it could be like a doorknob, or holding on to something to counterbalance the weight as you train the movement patterns. And a lot of people talk about like the motion is the lotion, which I know is like kind of cheese, but it's true. Like if you don't train the motion in the joint's not going to know how to do that, right? So slow and steady and consistency are really, really key. Yeah.
And there are, I mean, you mentioned, joints. Are there common injuries that you see in Hashimoto's patients?
Totally. Frozen shoulder is really common. And frozen shoulder, like, so let's say this is the arm bone and this is the socket. There's a little capsule that holds it in place, and there'll be adhesions or tightness in that capsule. And you'll have trouble washing your hair or even lifting your arm to put it in a shirt. And it is a long, long process, like 3 times a week in PT for a year and a half. And then one shoulder will heal. And then like the next year later, you'll see the other shoulder, right? And a lot of those women do not know that they have a thyroid issue. So like any woman that I see with a frozen shoulder, I'm like, have you had your thyroid checked lately? And really the best rehab for it is prevention, is doing strength, pushing moves, pressing, carry moves in different positions to make the shoulder joint strong. And also the core. A lot of women, I think culturally are programmed to suck the belly in and skinny up the waistline. And if you think about a baby, right? You never see a baby suck their belly in, right? They got like this little Buddha belly and they're breathing down and wide, and then they brace. Like if you kind of poked at their belly while they're in like transitioning from like a half kneel to a stand, it will be braced, it will be taut. And we grow up and then we're like, oh, we got to skinny up our belly. But that's actually not giving good core stability. It's not giving good pressure in our abdomen. So I think that's another aspect of frozen shoulder, is like you have to rehab the shoulder on a good foundation. So which would be the core. And we'd be breathing, we breathe 25,000 times a day. So if we're not breathing down and wide and giving ourselves good core stability, that's 25,000 moments that we could be potentially rehabbing ourselves. I think another one that's really common that I'll hear is women who have different sprains. They're like, oh, my wrist and then their ankle, and there's no like clear mechanism of injury. Like they didn't roll their ankle, they didn't fall on their hand, but they have these kind of like pain that moves around the body or sprains that kind of show up. That's also, I think that goes back to just like slower replenishing of the tissue and regenerating of the tissue. But also a sign like, oh, maybe do I need to get my blood work checked again? Maybe something's off. Yeah.
I think that's helpful. And I think people are probably coming to you, they're coming to us from a couple different avenues, people that know they have a thyroid condition, people who are showing up for you that are having injuries that might indicate that, or people who just feel like demotivated because they are gaining a lot of weight or they have really low energy. And so they want to work out, but they're not sure where to start, et cetera, et cetera. I guess my question for you is like, how can people get started on a new exercise routine? How do they figure out, where's their sweet spot between too much and too little? And then how do they stick with it?
Yeah. So I find that a lot of women are searching for motivation, right? And I think of motivation as like this well that's totally dry and we're like trying to get water from it. And I really believe in momentum over motivation, right? So making a game plan, finding something that resonates, and then little baby steps day by day. Not no one, but like the majority of people I know do not look at a kettlebell and they're like, oh yeah, I'm going to get after it. Like, let's go. They're like, okay, like, but you just make a game plan and you execute. And I think the women that I've seen get better and stronger and have more energy are the ones that don't ruminate on it too much. They're not like, should I do this? Should I do this? Does it require these shoes? Like they don't get too mixed up in even getting a kettlebell, for example. Like I've had women get a sandbag and put sand in it, or get a tote bag and put books in it. And they're like, that's my weight. All right, let's do it. So finding something that resonates with them, hopefully it's strength training. And there's a great Arthur Ashe quote. It's like, start where you are, use what you have, and do what you can. And all those aspects, like don't let something be a barrier. I think just start. And maybe it's 5 minutes, and then the next day it's 10 minutes. And then a week from now, it's 20 minutes, low reps, long rest breaks. And you're starting to feel like, also celebrate the small wins. And I know that's really hard where you're like in the depths of it, because I've totally been there, where like I can't even like make a sentence with like such bad brain fog. But I think it's important to, we're so up here all day with, computer and work and whatever it may be. And it's nice to kind of like get into our body and get out of our head, even if it's for like 3 reps of a couple moves. I think it will start to kind of jumpstart that, like, I don't feel like working out. Like, but people don't feel like, no one feels like working out. You just make a game plan, execute, do it again and again. And, the experts really in any field, they do the basics consistently. I know there's a lot of like sexy, crazy moves on social media. And even I'm like, whoa, like, let's not injure ourselves. But I think it's like doing the basics consistently again and again.
I think that's helpful to hear. I mean, what I'm hearing you say is like, something's better than nothing. And to hear from a movement specialist, just stick with the basics. You don't have to get crazy. And you don't look at a kettlebell and go, oh my gosh, I'm so excited. Or maybe you do, but I think it's encouraging.
I don't.
For people who are like looking at it from the get-go and are like, how do I get started? I think that's really helpful to hear.
Yeah. There's, if I don't feel good, I check on 3 things. I'm like, okay, so how am I eating? Am I hitting my like optimal protein targets? How's my sleep? Binge watching Netflix is my baby waking me up at 3 a.m. And then the last one is like, have I worked out in the last 3 days? And if one of those things are off, I don't necessarily go to all the things that could be off, right? Like I'm really sensitive to mold, so I used to be like, oh my God, there's mold in the house. Now I'm like, okay, oh, wait, my baby woke me up at midnight and 3 and 6 a.m. Maybe it's that. So I go to those 3 things, exercise being one of them. And then I just keep staying curious of like, how can I feel better in my body? How can I be present with my kids? How can I feel strong? And just really feel like optimized.
That's really helpful. And thinking again about these foundational pieces of your health, you've offered to demonstrate some moves that might be helpful to people who
Yeah,
are getting
totally.
started or who are wondering about strength training. Because again, I think
Yeah.
there is some confusion around like what is strength training? Does it have to be super extreme?
Yeah.
And so if you could show us some moves and maybe like, how to do them properly and why they might be helpful.
3 moves I think really every human being on this planet should be able to do, but especially every woman with an autoimmune condition. First one is a plank. It's gonna be an elevated plank. So I have a chair, I could be using the couch, it could literally be a kitchen counter or bathroom counter, an island, something up higher, okay? Take your hands on the chair, okay? So shoulders might want to ride up, pack them down. You're gonna step your feet outer hip width, okay? Notice I'm not looking ahead. That will create not only straining in your voice, but a little overarching of the low back. So you're gonna look right down at your thumbs, long neck, soft chin. If your shoulders are like this, actively push the chair away, especially through your index knuckles. Squeeze your tush like you're cracking a walnut and reach out through your heels for maybe 5 breaths. An audible exhale will force you to brace. As women, sometimes we suck up and in, but when you're lifting weights or you're picking up your kid or your suitcase for the overhead, you don't want to suck in. You actually want to kind of create a little tank of strength by breathing down and wide and then brace, almost like you're pushing into that resistance. So you can play with it here. When you make it audible, like a cha, you actually feel your hands go pew. So try that breath as you're doing these moves. So first move, top of a plank, top of a push-up, except we didn't do the push-up part. Could be off a kitchen counter. I'm gonna move my chair to the side here. Second move is a deadlift. I know when women hear deadlifts, they think that's a little scary. It doesn't have to be scary. It's how we lift boxes. So when people say use your legs, not your back, they usually think of a squat, but it's actually a deadlift. So I have a kettlebell. You could grab some weight. You need a weight that is heavy enough to have some resistance for your hamstrings, the backs of your legs to activate. If your knees hyperextend, like your knees go back behind your ankles, this one is especially good for you because that hypermobility I have seen clinically often happens sometimes with autoimmune conditions. So here's the bell. It could be a bag, tote bag full of books. I've had women use sandbags, dumbbells propped upright. So you're gonna step so it lines up with your inner arches. Hands in your hip crease. You're just gonna fold your belly towards the tops of your thighs over your hands, okay? And now you're in the perfect position. Nice long back, not overarched, not rounded, okay? Feet will be turned out to like 1 o'clock and 11 o'clock. So hands in the hip crease, fold your belly, grab your weight, take a breath in. I'm gonna stand up and you're just gonna squeeze your butt. So your ribs will be right over your tush, not pushing through. You're gonna park the bell or your weight right where you found it. I'm gonna face you for this rep. So here's my bell. Handle lines up with my inner arches. Hands in the hip crease. I just fold my belly towards my hips. My knees point towards my second toes. I grab the bell. That audible, forceful exhale. So So first move, plank. Second move, deadlift. Notice the deadlift at the top. You let go of the bell and your arms are here, is the top of a plank. The last one is going to be a lunge. And I know a lot of women with Hashimoto's go, uh-oh, a lunge. That sounds scary because I have cranky knees, especially right there, right at my infrapatellar tendon. So you can do these body weight. You could do holding a bell right here. I'll give you options, okay? So you're gonna start kind of like a split stance, okay? And take a breath. You're gonna lean a little bit forward. You're gonna go down, okay? You're gonna see where your knees land. You kind of want your knees at like 90, 90. It's okay if this knee goes in front of 90, okay? So you can start at the bottom. Make your way to the top, okay? Inhale. You could find something to tap to. If you had a yoga block, you could put on the floor and then just tap your knee to the yoga block, okay? That's the unweighted version of a split squat. If you wanted weighted, grab a weight. I'm gonna grab a kettlebell here. It's gonna be to the opposite side of my front leg, okay? So I just did my left leg. I'm gonna do right leg forward. So right leg forward, left leg back, bells in the left hand. And notice I'm not trying to stay upright. That will cause a big arch in the back. I'm gonna lean forward just a little bit so my ribs stay over my pelvis. Squeeze. You could tap to a yoga block, something that will bring your knee off the floor. And here, you're working quads, your glutes, and your core. I call those sneaky abs because they're forcing you to work your obliques without doing twisting, without doing crunches. So 3 moves. Top of a plank, deadlift, and a split squat or a lunge.
I do think an important piece that a lot of doctors don't talk about is this element of hypermobility. And there's no research. I mean, there are people who research hypermobility, but not in relationship to autoimmune conditions. And I noticed it in my practice, and it's more of a clinical observation just because the research is not out there. But I noticed this element of like tissue laxity. Like the joints, the knees will go back, will like extend back behind the ankles. You know, sometimes that won't, like, I'll have patients tell me, you know, I'm in yoga and I'm always that one who the instructor comes around and tells me to like put a little bend in my elbows. And so there's certain points in the body, it's called a Baton score, where you can check and see, okay, is there hypermobility in these places? And if so, then starting to kind of look at how to rehab lax joints. And a lot of those women really love yoga, right? They love to like fold in half and palm the floor with their knees straight. And I think it's important. Like I've had to really, a lot of those women kind of like take away the yoga, which sometimes I feel like I'm taking away their soul. And give them strength training, but they do so much better. They feel so much better. Like their joints feel more strong and stable. And this is also coming, I'm also a yoga instructor. So for a yoga instructor to be like, okay, I'm going to take away the yoga. It's probably not the norm. And yes, you give them strength. And I also noticed like this element of kind of like anxiety, right? Anxiety, depression, but like the energy is like up here. And if you think about the joints not being able to like ground and find themselves and be stable, someone's not going to feel grounded. They're going to feel kind of like more anxious. There's other papers out there about blood flow and blood pressure and blood, like the venous return not being as strong. And that's why there's like this element of anxiety. But I found that the anxiety kind of tamps down a little bit when these women start to pick up a heavy weight and move it and do it again and again.
Anything else that you think is important to share about the importance of building and protecting muscle for someone who's living with Hashimoto's disease?
Yeah, I think, the two biggest struggles I hear are fatigue. I'm tired, I'm exhausted, and I can't lose weight. And I think the immediate benefits you can feel really quickly are having more energy, even with like 20 minutes of like deadlifts, a plank, and some sort of lunge. Like you will feel a difference. I think with weight gain, I think it's definitely a trickier path. And, I think there's inflammation that's an element. I think a lot of times when we work out, we're also now more hungry and taking in more calories. And there has to be a little bit element of caloric restriction in terms of weight loss. And I think in terms of muscle, strength training is going to give you the benefit to both of those struggles. You'll probably feel more energy first, and then like I feel like weight loss is just kind of like icing on the cake. But yeah, it's really hard. Like our kind of what someone else is like building muscle, because we have lower thyroid, is going to be kind of like a baseline maintenance. So I think just being consistent and staying with it, knowing that it is momentum over motivation. And most people don't look at a weight and go, woohoo, let's do this. I think it's just an important kind of reframe and aspect. But if you like everything I do in my day, and I know this sounds maybe crazy, sounds normal to me, is around maintaining my muscle mass and energy levels so that I can be present with my kids, because my kids love to wrestle and be thrown around and want to be picked up like 50 times a day. So everything from like when I go to bed to protein, really focusing and optimizing protein, right? Getting 30 grams a meal to optimize muscle protein synthesis, to how I train. So, that's the lens that I go through, but I feel best in my body when I do that. We all get cravings. Like sometimes like, oh, I want like some like 10 at night, but I'm like, you know what? I know I'm not going to feel good the next day. And like that little probably carb load is not going to necessarily help with how I feel the next day. So yeah.
Yeah, I think that's helpful to hear. Building muscle, losing weight, all of these things, like all of it's the long game. You're in it for your whole life. It's not a quick fix. And so I think that's helpful. Maybe it's going to take people a little bit to think about it in every aspect of their life. But like you said, like momentum over motivation is a good thing for people to hear. And if they want to learn more about you and your program as a place to get started or continue on their, thyroid health journey, where can they find you?
Yeah, so they can find me at dremilykiberd.com. And then on there is a 6-week program called Thyroid Strong, and takes you through like all the things I wish I had learned in high school, like how to breathe and brace and cue and pick up a weight without injuring myself. Where should my feet be? Should my toes be turned out? Like all the things. And then after that, there's Stay Strong, which is a membership program, which is focuses on just a progression of exercise. So I have women who, when they started Thyroid Strong, they ordered a 12-kilo kettlebell, so that'd be 25 pounds. And they would email me and be like, just getting the kettlebell from the porch in the house felt like a workout. How am I ever going to do this? And I was like, it's okay. We're going to do it step by step, momentum, keeping the momentum. And now these women are doing kettlebell swings and Turkish get-ups in the membership, and they're like just really amazing stories of, you know, people going camping this summer and being like, I never would have thought I'd be like, we're really housebound and kind of bedridden. And like, they were like, I never thought I'd be able to do this, like traveling with my husband across the country and go camping and be like moving stuff at the campsite. So, yeah, so dremilykiberd.com, Thyroid Strong.
I love that you keep bringing it back to being strong so that you can live your life, like not being strong just for the sake of being strong, but being able to play with your kids and go camping in the summer. I like that connection a lot. It's not just for the sake of doing it because it's a thing on your checklist. So thank you so much for sharing all of this information with us. And we'll make sure that all of those links are included somewhere so that people can find you online and find your programs.
Awesome. Thanks so much for having me.